This month, we shine the light on breast cancer awareness. 1 in 8 women will be diagnosed with breast cancer in their lifetime. Can you believe that?
I can't.
And with today's advancements in genetic testing, women can choose to get ahead of the diagnosis.
That's right. There are many steps and individuals involved who can help you navigate these times. A support network of not only friends and family, but your surgical team as well.
So we traveled to San Antonio, Texas to learn more about options available to help women strengthen their sense of wholeness and confidence.
Take a look.
Rebecca Holly Muniz is all too familiar with breast cancer. Her mother is a survivor, and genetic testing showed she was at risk.
My mom was diagnosed probably when I was about 15 or 16, and that was a very, very scary time for me. I remember being so scared for my mom. And just so worried, and I do remember it was a very long road. That was a very, very trying time for her. And since it is a genetic trait, we decided I should probably go ahead and get tested as well, so I did. And lo and behold, I was BRCA2 positive as well. I had a mammogram within 10 days, and it made it seem like it was, oh my gosh, you might have breast cancer right now. So that was a very emotional time and a very emotional roller coaster for me.
At 28 years old with the BRCA2 diagnosis, Rebecca chose to own her destiny instead of letting the gene decide her fate.
I was already at about a 30% risk of developing it. So that was always just kind of in the back of my mind. So after my first mammogram, I actually went and met with a genetic counselor. And that was immensely helpful. She really gave me a lot of information just about the gene itself. She gave me options because initially I was thinking, I only have 2. I had living with it or doing the mastectomy because I didn't want to live with going to have a mammogram and going to have an MRI every 6 months and then waiting for those results and just thinking, well, what if it comes back positive, and what if I should have done this 6 months ago? My husband, Jason, was really the biggest support that I had. He let me come home from work every day, sit on the couch, rub my feet, and let me cry about why I had this gene and what I was going through. And he really helped me come to the decision. And ultimately, he told me it didn't matter to him what I chose to do. It was up to me and what would make me happiest and most comfortable with.
To help make an informed decision, Rebecca researched the breast reconstruction process and options. She found support, information, and education within the breast cancer community.
So I decided to go ahead and do the prophylactic double mastectomy with reconstruction to know that I was able to have a reconstruction option that was going to give me back part of myself was very reassuring. And it really it helped me own my identity a little more.
As a 2-time breast cancer survivor and reconstruction patient, Terry QT knows the unique challenges and frustrations other patients face.
My breast cancer journey started back in 2002. I was diagnosed the first time, and then in 2014 I had a recurrence and a new cancer in the other breast. The day I was told about my mastectomy, it was my first experience with a shared decision-making conversation with my healthcare team. My breast surgeon gave me all my options for breast reconstruction. I didn't even go into that appointment thinking about breast reconstruction. I went into that appointment thinking, I'm gonna lose my breast. I'm gonna lose a body part that defined me as a woman. But she told me all of my options, and so I left there with this huge sense of hope.
And a new purpose in life. Terry, a former teacher, went into warrior mode and founded Deep Sea Foundation to help others looking for information on reconstruction.
What we do is to give them all the resources they need to empower them to make this decision. For me, this is a pay it forward moment. How can I help other women and men go through this process and make it easier on them?
And when Rebecca met Terry, it was a powerful connection.
Her story, it holds so much bravery. She knows her body's going to be changed. She had to find someone that she trusted to do this work to move her forward in her own personal journey so that she could be there for others in her life and live a full life herself.
I was really needing to talk to someone that has been through this and has done it. Right. Someone young like myself that has gone through something like this.
One thing they had in common, taking the shared decision-making approach to their treatment, empowering themselves to work with their surgical team in determining the best reconstruction pathway.
The shared decision-making approach really empowers patients to have a voice in their treatment planning and to really own their journey. Instead, it's a collaboration between the surgeon and the patient. We describe the options, we describe the risks, recovery, everything that goes into making a medical decision. But we also expect and invite the patient to bring their preferences. And then we marry all that together along with evidence-based medicine to come up with the best treatment plan for that individual patient.
Emotionally and physically, this preventative measure was the right decision for Rebecca. Her physicians made sure she understood all the considerations of breast removal and reconstruction.
Women have many options when it comes to breast reconstruction. There are two main categories. One is implants and the other is using their own tissue. Implant reconstruction can be performed in a staged approach, either at the time of the mastectomy or any time later.
I would have an expander at first, and I would go up, every 3 or so weeks to have those gradually filled.
We chose a two-stage approach using an Artura expander at the first stage to increase the overall breast size, the footprint, and the size of the skin envelope.
We decided to go ahead and do that under the muscle. They thought that would give me the most lifelike look, which is what I really ultimately wanted. I didn't want anything to look really fake.
And that allowed us to put in a slightly larger implant to help us achieve the size goal that she wanted.
I wanted to still come out of this procedure looking like me, but maybe a better version of me.
After 4 months of slowly expanding the area, Rebecca was now ready for the second stage of reconstruction, implants.
In Rebecca's case, it was really very important to have a soft and natural feeling result. So knowing that, we were able to choose the right implants and really maximize the chances of a successful outcome in her eyes. Ultimately, we chose a mentor memory gel, smooth round silicone gel implant for Rebecca because we felt it best suited her goals. So it's important when you're choosing implants to use a manufacturer that has a wide range. Mentor's range is really very nice because it checks all the boxes and we can adjust our implant choices based on the patient's desires, goals.
I am very, very happy with the choice of implant that I have. It feels natural, it looks natural, and it gives me everything I would have wanted. I really feel like I have just gotten back into normal, regular life. I'm a very active person. I ride horses, I go sailing, I go swimming, and I feel like they're just a part of my body. They give me, all the options that I had before.
My advice to anyone embarking on this journey is to be your best advocate. Empower yourself, do the research, use decision aids like the Breast Advocate app, and really push to have the conversation that you want to have.
For these women, the path to surgery and finding support through healing and moving on with life after breast cancer has merged into a desire to help others.
I want to be able to tell other women, it's okay. You're going to be fine, and you'll be beautiful on the other side, just as you were when you went in it.
I'm inspired by women like Rebecca every day that I meet people like Rebecca and other women. It just inspires me to continue my work.
Our thanks to Rebecca for sharing her wonderful story, and Terry for advocating on behalf of women everywhere. We thank you so much.
Yes, we do.
You can go to breastimplantsbymentor.com for more information.
You can also learn more at thebalancingact.com, and we want you to stay with us because we'll be right back.